A GMA Health Alert right now. New research indicating acupuncture may provide more relief for chronic lower back pain in older adults than medications alone. Our Chief Medical Correspondent, Dr. Taryn Rule, is here with more. You got to break down this study for
Good
us.
morning.
Good morning.
Yes, so chronic low back pain is so disabling, and it affects about a third of Americans over the age of 65. We talk about medications and surgery. They're costly. They don't always work. So acupuncture has emerged as another potential option. Now, acupuncture is 2,000 years old. It's been practiced in China and Eastern medicine since then. Really came into this country in the 1970s, actually, Robin, when a New York Times reporter was in China. He was in the press corps, had his appendix taken out, and got acupuncture used for post-operative pain management, came back and wrote about it. So we've seen this kind of advancement in this country. It's been used for cancer symptoms, gastrointestinal issues, psychological, and back pain. The way it works is really 5 to 20 of these very fine needles that are put into different anatomic positions, and they're left in for about 10 to 15 minutes. The idea is that it kind of improves the chi, or the vital life energy force. Now, in this study, they looked at 800 older Americans over the age of 65 with chronic low back pain. They divided them into 3 groups. A third got standard medical care, a third got standard care plus acupuncture for about 3 months, about 15 sessions, and then the last group got an extension. They did about 6 months of acupuncture. They found that the groups that got acupuncture, both groups, had a reduction in pain disability at 6 months and 12 months, a reduction in pain intensity at 6 months, improvement in their physical function at 6 months, and improvement in overall anxiety. So a lot of improvements with just acupuncture.
Wow, that is really something there. I've tried it a couple of times. It's pretty effective for me. What else do people know about it?
Yeah, so it's generally safe, and as you mentioned, there are not a lot of contraindications. So people might think if I'm on blood thinners, I can't do it, or if I'm pregnant. I know I did it when I was pregnant. And really, as I mentioned, it's been used for a lot of different conditions, not just for pain. Medicare actually covers up to 20 sessions in the course of a year. Some private insurance companies cover it too. And you can look online and see who is certified, who's licensed. We do know there's about almost 40,000 practitioners in the U.S., mostly centered in New York, California, and Florida. And a lot of even the cancer centers, National Cancer Institute centers that are designated as such, use acupuncture as part of their hospital-based treatment. So really, you know, an explosion in acupuncture in the last 30 years, and can be helpful for a lot of people.
Let me ask you, it doesn't hurt at all? You don't feel
It
it?
doesn't.
It's
they're so tiny.
Yeah.
Yeah.
Good to know.
Yeah.